Hello, this is Alexandra Harrison from Supporting Child Caregivers. Today I'm going to talk to you about postpartum depression in the time of the COVID virus. I'd like to start by asking, who are the most vulnerable people to becoming ill with COVID or to becoming seriously stressed by the pandemic? Well, we know that people who have jobs that expose them to other infected people are more vulnerable. For example, frontline workers, policemen, firefighters, doctors and nurses and technicians in hospitals, and cleaners in hospitals, public transportation workers, delivery people. All these people are much more vulnerable to getting exposed to the virus. But then there are other people too. These people are people in the time of life when they are particularly dependent on others, such as infants and the elderly and pregnant women and mothers of newborns. One way of understanding how individuals manage the stress of the pandemic is to think of them as experiencing a set of factors that deplete their energy to manage the stress and illness or enhance their energy to manage the stress or illness. That is, to take away their energy or to give them more energy. And I'm going to refer to these as resource depleting factors, RDF, or resource enhancing factors, REF. Some of these factors are acting in the woman's present life, such as the RDFs of underlying health conditions or inherited predispositions to a certain illness or domestic violence, and others are factors from their past, such as growing up with domestic violence or a mentally ill parent or experiencing abuse as a child. Examples of resource-enhancing factors that give you energy to manage stress and illness, include financial security and family support. Both present and past factors influence the health of an individual and also influence the way they handle stress in the environment, such as the pandemic. In addition to genes, in addition to inheriting genes that make you more robust in terms of managing stress and illness, some inherited factors include molecules that sit on top of the genes and turn them off and on. Well, of course, that's a metaphor. These molecules they moderate the expression of the genes in relation to the context of the environment, such as famine or war. And this is called epigenetics, and these molecules, as I said, can also be inherited. Now, if there are enough RDFs, resource-depleting factors, in a woman's life when she's pregnant, she's more likely to develop postpartum depression. What typically happens is that one resource-depleting factor, an RDF, builds on another in what we call a cascade until the woman's mood reaches a tipping point and she becomes clinically depressed. I'll explain how that cascade might play out, but first I want to tell you more about postpartum depression. The symptoms of postpartum depression include pervasive low mood, loss of interest, feelings of guilt, and sometimes the wish to die. And postpartum depression also usually includes neurophysiological factors, such as disturbances in sleep or appetite, loss of concentration, excessive fatigue, and sometimes either retardation, a slowing down, or agitation. Now, it seems that postpartum depression is actually a relatively common disorder. The prevalence of women with depression 3 months after the birth of their baby is about 13% in high-income countries and 20% in low-income countries. Most women with postpartum depression get better without any intervention even by 6 months after their baby is born, but a significant proportion of them, about a third, are still depressed when their baby is 1 year old. Now, if most women with postpartum depression recover without treatment by 6 months after the birth, why are we so concerned about it? Well, we're so concerned because postpartum depression has a very serious effect on the development of an infant. Postpartum depression occurs at a time in life when the infant is most dependent on his mother's sensitive responses for his healthy development. Yet mothers with postpartum depression tend in general to show a kind of insensitivity to their infant's cues. Of course, it's certainly not their fault. It's because of their depression. And infants of depressed mothers are likely to avoid contact with their mothers and also appear distressed. Postpartum depression in the mother can interfere with the child's emotional development and even cognitive development. So let's look at how resource depleting factors might create a cascade that reaches the point of postpartum depression. First, there's the mother's inheritance. Depression is in part inherited, so if the mother carries genes for depression, that would be considered an RDF. In fact, the incidence of postpartum depression is higher in women who've had a previous depressive episode. Next, there are neurophysiological changes in pregnancy and childbirth that change the brain of a pregnant woman and also give her hormonal changes that all create emotional instability. So that's another RDF. If the mother experiences complications in pregnancy or in childbirth, that's very stressful to her, and that makes her more likely to have PPD, so that's another RDF. In addition, there's the mother's current life circumstances, of course. If she has experienced abandonment or loss of an important person in her life, her partner, her parent, an important friend, if she has financial insecurity or food insecurity, or if she has inadequate housing, if she's the victim of domestic violence, these are all important RDFs. But also the mother's adverse childhood experiences, including her experience of caregiving from her own parents, such as neglect and abuse, these are RDFs. Problematic ways that the mother's parents treated her as a child, that's what we call ghosts in the nursery. These are important RDFs. Finally, there's the mother's ancestral history of trauma. Perhaps she has descendants who were slaves. Perhaps she has descendants who lived through a war. And also immigration can be very traumatic. All of these factors influence her through epigenetic processes, the ones from her ancestral past. Now, I would like to end on a more positive note by asking what we can do to help women with postpartum depression. What are some recommendations? Well, I recommend that we try to create the opposite kind of cascade from resource depleting factors and make a cascade of resource enhancing factors. And we have to start by evaluating the severity of the mother's depression and making decisions about treatment needs. She might need psychotherapy or medication. This caretaking is a resource enhancing factor. It's something that can help give her the energy she needs to recover and to manage the stress of the virus. Next, I would focus on her isolation, which is a very depleting of resources factor in any new mother's life, but especially if she has depression. I would ask who among her family and friends can give her non-judgmental support. I would also then try to support those caregivers of hers. I would try to support her partner, her family, her friends, in order to give them the energy to support her. This is a kind of systems intervention, and I would call that a resource enhancing factor. Another important something to remember is help with childcare, because infants they grow too quickly. They cannot really wait for their mother to get completely better from depression. So she needs someone to help her take care of her baby while she's recovering. That is an REF. Also, a wonderful way to support mothers is through mother support groups. Now, during the COVID crisis, of course, these have to be virtual, but still there are some mother support groups online, and they can be very helpful to mothers. Finally, there can be interventions with the mother and baby together, what we call a dyadic intervention. And this can be a newborn behavioral observation or a similar kind of intervention. It can be a psychodynamic intervention with mother and baby together, virtual, of course. It can be home visiting, which would also have to be virtual during the pandemic, and video feedback, also virtual. All these are going to have to be remote, but they can all be very valuable resource-enhancing factors. So as I said, all these interventions aim to create a cascade of resource-enhancing factors to strengthen the mother of the newborn so that she has the energy to fight against her depression and also against the stress of the pandemic, especially the isolation. That means that this accumulation of resource-enhancing factors can create a momentum in the direction of growth, a cascade of positive factors towards a good outcome. You remember I talked about ghosts in the nursery in terms of the problems of caregiving that the mother experienced in her own childhood. Now I'm talking about building communities of angels in all these different resource-enhancing factors. Communities of people who can provide the material and social and emotional supports for a mother with postpartum depression and also her family. Thank you.